Another key feature of the framework for action response was the creation of this facility. This is Insight. This is Vancouver's supervised injection facility, which, after much public debate, finally opened in 2003. It was opened as a scientific pilot study. That's how it was regulated. It was only allowed to open, and people were exempt from provisions within our federal drug laws, provided that it was subjected to rigorous evaluation. The facility is open 18 hours a day from 10 a.m. till 4 a.m. in the morning. There are 12 booths for injecting. They supervise anywhere between 600 to 1,000 injections per day. The objectives are very simple, much like the Sydney Injection Center. The goals were to reduce public disorder associated with injecting in public, reduce risk for transmission of various infectious diseases, including abscesses and soft tissue infections, which in our setting account for the majority of emergency room and acute hospitalization utilization by drug users. As well, the program sought to increase contact with external health and social services and reduce risk for overdose. Sadly, before any evaluation data was available, the program became heavily politicized. We had a visit from John Walters, the White House Office of Drug Control Policy Director, who, again, before any data was even available, declared that Insight was nothing other than state-sponsored suicide. But we were able to, through the existence of our cohort infrastructure, we were able to quickly produce some evaluation data, including this paper, which documented some changes in public disorder in the neighborhood. This dotted line shows you the opening of the facility. This is the number of weeks, and you can see within the first 12 weeks, the number of people using the facility leveled off at about 500. It's much higher now. Then we had an ethnographer walk around the neighborhood in a 10-block area and do systematic field counts of the number of people who were injecting, the amount of injecting litter, as well as the number of police on the streets. And as you can see, as the number of drug users went up, the amount of people seen injecting in public went down. In order to validate the counts, we correlated the counts of discard syringes with those being collected in the city disposal boxes, and they correlated well. We then ran a series of regression models, knowing that people would say, well, you know, police presence could have done it. You did this work in September when it starts to rain in Vancouver. So we ran a series of regression models where these markers of disorder were the dependent variable. We adjusted for police presence and rainfall obtained from the Environment Canada statistics, and the number of people using the facility each day reliably predicted improvements in each measure. We also documented changes in syringe sharing associated with the facility. Specifically, those who were using the facility on a frequent basis were about 70% less likely to report syringe sharing. Again, we took advantage of the pre-existing cohort. We compared rates of syringe sharing before and after the facility among those who did eventually use the facility and those who didn't, and the rates were the same, meaning the protections that we observed in this study really only emerged after the facility opened. We also, using a record linkage, we obtained hard data on the number of people registering into detoxification programs and found that people who used the facility more frequently were more likely to enter a detoxification program. We followed that up with this paper, and again, using a record linkage, we compared the number of people who entered a detoxification program in our cohort of injection site users before the Insight opened and after. And in a multivariate model, we found that there was about a greater than 30% increase in detoxification program use. And people who went into a detoxification program did what we hoped they would do. They then went on to enter more abstinence-oriented addiction treatment programs. Then, using the database within the facility itself, we were able to determine that those who went to a detoxification program, then went into addiction treatment, reduced their reliance on the facility, as there was a statistically significant decline in re-entry into the facility after one had been admitted to a detox program. Recently, we sought to evaluate whether the facility was having impact on rates of overdose deaths. And for this study, we accessed data from the BC Coroner's Office on all illicit drug overdose deaths in the province of British Columbia. And Brandon Marshall, a brilliant young researcher, used GIS methods to map all these overdoses in the city of Vancouver. This yellow dot here is the supervised injection facility, and you can see that in this roughly 5-year period, the heaviest concentration of overdoses were right around the injection facility. Then we used data from our cohort which showed that the people who used the facility, who were likely to use it on a daily basis, lived within 3 blocks of the facility. And so we determined that a 3-block distance was roughly 500 meters, so we created a custom map that included every block that had a centroid within 500 meters of the facility. That became our area of interest, and we used the rest of the city as a control. What this map shows you is the incidence density of overdose deaths in the period before Inside opened and the period after. The darker the color, the heavier the density. You can see that there was a reduction in overdose deaths in the period after. And when we evaluated that, it turned out that the reduction was around the facility was 35%, and while it was only 9% in the rest of the city, and that was non-significant. We've also exported data to other researchers who have demonstrated that Vancouver's injection site is highly cost effective. It's estimated that over a 10-year period it would result in approximately $18 million in cost savings. As well, we've conducted a number of studies to show that Inside is not having any of the anticipated negative effects. It hasn't resulted in an increase in drug-related crime. It hasn't promoted initiation into injecting among youth at high risk to inject. And it hasn't exacerbated drug use patterns in the community. So while the facility seemed to be a success from the point of the evaluation, and we had engaged in a whole variety of knowledge translation activities, including plain language summaries and reports and policy briefs and face-to-face briefings with various policymakers. And the Vancouver Police Department itself was supportive and actively referring people to the center. There were those who were quite opposed to it, including the Canadian Police Association. And we were very concerned because at the time the 3-year exemption was about to expire, Stephen Harper's Conservative government had obtained minority government status and had made a number of negative comments about the facility. And then literally 3 hours before the federal health minister made his announcement about the future of Insight, on the Friday of a September long weekend, the Canadian Police Association issued this response saying that this harm reduction focus had led to unprecedented levels of crime, despite the fact that the VPD's own statistics show that crime had actually remained stable or declined in some senses. And then within a few hours, the health minister himself declared that he was going to extend the pilot for another 18 months, but he was cutting funding off for the evaluation. I guess he didn't like the results. Then to our surprise, one morning this paper appeared in the Institute of Global Drug Policy. I'm sure most of you haven't heard of it. That's because this paper appeared in Volume 1, Issue 1, and it's not really a journal. It's actually a website operated by the Drug Free America Foundation, and it's a remarkable innovation because really what it is a website posing as an online open access journal. But if you look at it and flip through it, there's not a single paper there involving original data involving human subjects. In fact, it's just a series of papers that are rants against harm reduction. When you call the office, you get an office in Florida, which is the Drug Free America Foundation, and the website is also registered to the Drug Free America Foundation. And much to our surprise, the Institute on Global Drug Policy is very explicit about their mission, which is to create and strengthen international laws that hold drug users and dealers criminally accountable for their action. The Institute supports efforts to vigorously oppose policies based on the concept of harm reduction. And this paper that I was showing you is written by an individual who also has never published a paper involving human subjects, but concluded that our evaluation was entirely flawed, that the New England Journal of Medicine, the Lancet, were basically journals operated by harm reduction advocates, and that if you really carefully examine the data we produced, it's very clear that Insight is creating a number of harms and has no benefits. Unfortunately, it led to a number of headlines, such as this one in our national newspaper, declaring that harm reduction doesn't work. Fearing that the new Conservative federal government would close Insite, the crafty NGO that runs the facility and 2 members of the Vancouver Area Network of Drug Users took the federal government to court. They put forward 2 arguments in the BC Supreme Court, one that closing Insite would violate the constitutional right to the highest attainable standard of health, and an argument based on interjurisdictional immunity, meaning that it was really the province that had the authority to determine what health services it would run, even if those health services contravened the national drug laws. And eventually the BC Supreme Court Justice Pitfield argued in favor of Insite, declaring that it did in fact violate the constitutional right if it was closed. He didn't argue on, he didn't offer much of a judgment on the interjurisdictional immunity argument. And although people were quite pleased, within a couple of days the Minister of Health made this public statement, citing the paper from the journal, the Global Journal of Drug Policy and Practice. He said, "I think it's quite clear from my remarks today that there exists a significant degree of uncertainty in the research." Sounds like climate change, doesn't it? "I can inform you today that I'll be asking the Minister of Justice to appeal Judge Pitfield's decision at the earliest possible opportunity." And it was at this point that the Conservatives closed our national office of the scientific advisor, had muzzled Environment Canada scientists, and done a number of other things that really offended Canadian scientists. So along with some people working in the area of environmental science, we formed the Coalition of Concerned Scientists. We issued a number of media statements about calling for an end to the politicization of science in Canada, which was successful in drawing attention to this problem. But when the case went to the BC Court of Appeal, the 3 justices actually ruled in favor of the interjurisdictional immunity argument, saying that the province had the authority to run this program despite the fact that running it violated some of our national drug laws. They said, we're not going to really say much about the constitutional argument, but we basically agree with it as well. But then the federal government again decided to waste more of our precious public dollars and decided to appeal this to the highest court in the country. And about 2 months ago, the case was heard at the Supreme Court of Canada. What was really interesting this time is that pretty much everyone stepped up to the plate to seek intervenor status, and supporters of Insite included the Canadian Medical Association, the Canadian Public Health Association, and the Canadian Association of Nurses. And we are expecting a decision in the next 4 months.